if it's icy, it's bad. So Christmas Eve, we were a little worried. So some people were planned to come Christmas Day rather than, one year we had so much snow. Father had the fastest Christmas Eve mass he ever said, so people could get out and home, because within an hour it was like unbelievable. So, but yeah, we have two plows now in the whole town, which is interesting. We only had one before that, so
Double the
not
fun.
that it's a big town, but they don't handle it like in New England and that. So
yeah, I remember getting just barely any snow, and they closing down. I think it was for 3 weeks or something like that. I mean, there was hardly any snow, but it was a lot of fun. We had a hill right outside our house, and we'd do bonfires at the bottom of the hill, and it was great to sled down, and we thought we were really doing something. None of us had good winter boots. We put plastic bags over our feet. Yeah, I'll lead the meeting. That's fine. Oh no, shoot. I'll lead the and I should talk to you guys about that, because I've been having it too.
Oh.
So I found some really interesting information out that seems to have helped me a lot. So geez. Okay, I'm gonna sit back down. I hope we get a good turnout to this meeting, but if we do, we do, and if we don't, we don't. Yeah, I'm gonna sit down. You'll hear, I'll turn off my noise.
Oh, there you go, Sister Pat.
yes, I'm here. I have to leave I'll be back. I have to respond to this text, and that
Okay.
I shall return. We had someone died in our parish yesterday, and we're setting up the funeral arrangements and everything. So I will return very shortly.
That's important. So Lori, should I tell you what? Terrific. Okie. Hi, Ellen. Lee, long time no see.
Really?
We got some new people on, or at least new to me. That's great. That's great. Hi, Darla.
Hello.
Welcome.
Welcome.
Ellen, welcome. Deirdre, welcome. I think what we should do is go around and do some quick introductions, because we do have some new people, or maybe new to some people. And I'm not always the best with names, so forgive me if we've met before and I didn't get it down. I'm Lisa Del Bono, and Lori and Rob Byron and I lead the Health Action Team, and we've been doing that for a while now. And I'm up in Traverse City, Michigan, and I'm a retired pathologist, and yeah, I'm a CCL volunteer, and also have a little nonprofit from Michigan. So I'll just call on you, Lee. Do you want to introduce yourself?
Yeah, Lee Balance. I'm in Berkeley adjacent Kensington, California. I'm a retired physician, and I've been part of the Health Action Team for a long time.
Great. Wayne, do you want to introduce yourself?
Hey, Wayne Gothinkle, retired EPA, Children's Environmental Health, as well as a bunch of other things, including permitting, hazardous waste facilities and cleanup. Also serving as the leader for the Roswell Marietta chapter, and I can serve as a consultant for the Southeast PACU, Pediatric
Southeast
Environmental
what?
Health Specialty Unit.
Oh, gotcha. Great. Wayne, Bob?
Yeah, hi, I'm Bob Kitchen, retired family physician, live in Fairfax Station, Virginia. So member of the Fairfax chapter, CCL, and also Virginia Clinicians for Climate Action.
Great, thanks, Bob. Darla,
Oh, yes. Hi, I'm a family practice physician from New Hampshire in the Nashua area. And I'm starting to do some
I think your internet slowed down. I'm sorry, Darla, maybe we'll circle back, but we got that you're a family practitioner and you're from the Nashville area. You want to try one more time?
Yep. I'm from Nashua, New Hampshire, and I'm a member of the New Hampshire Healthcare Workers for Climate Action,
Ah,
and
great,
the New Hampshire Network. So
great. That's terrific. We're a lot of us are involved in the state affiliate, so really glad that to the consortium. Really glad that you're here. Deirdre.
I'm Deirdre Henderson. I'm the group leader of the North Tahoe, California chapter of CCL. I'm not a medical provider at all. I'm a lawyer, but I joined the Health Action Team because we have been trying to reach out to our local healthcare district, which is a major employer in our area.
Gotcha. Good. Thanks. Welcome, Deirdre. Now everybody moved. Patsy, do you want to introduce yourself?
Hi, I'm Patsy Beffinagrini. I'm from Nelson, New Hampshire. And I also know Darla. We are involved with the New Hampshire Network for Environment, Energy, and Climate and the New Hampshire Healthcare Workers for Climate Action. And I have been doing some volunteering with the CCL, mostly the Monadnock chapter for the last couple years.
That's great. And I am taking a class with Emily, your Emily Johnson. She is so impressive. I mean, if we could clone her, she's amazing. Rob and Lori?
Yeah, this is Rob and Lori from Montana. We co-chair it with Lisa. Lori is having an episode of vertigo, so she's in the background resting quietly and listening.
Oh, Sister Pat.
I'm Sister
Hope
Pat.
that Lori gets better. Let me just say, we really are thinking about her. Vertigo is absolutely horrible. So speedy recovery. Sister Pat, sorry to interrupt.
That's okay. I'm Sister Pat Cataldi. I'm a retired surgeon. After being in St. Lucia and Zimbabwe for like 17 years, I came to Eastern Kentucky, where I'm in Louisa, right across the river from West Virginia. I'm involved with the Health Action Team, Catholic Action Team, and CCL of Northern Kentucky because I'm only one of two people in Hal Rogers' district in Eastern Kentucky. So we work through them and trying to increasing our membership in that spot though.
Well, I love that you guys are here. Kentucky is my home state. Steve, you want to introduce yourself?
Yeah, I'm Steve Ashmead. I'm from Grand Rapids, Michigan, and I work with the local chapter here of CCL and also in the state consortium.
Steve and I work together all the time in our state group. Don?
Yeah, hi. I now live in the San Luis Obispo, California, and I'm a recently retired physician and a presenter for our CCL chapter and a recently co-leader of our chapter here in San Luis Obispo. And I've been learning something about this En-ROADS, and you mentioned about En-ROADS, and I'm curious to know how we can use that in our presentations and other methods.
Well, I'm doing, God help me, I'm doing the health messaging according to En-ROADS for their En-ROADS action team in February. So Don, you and I could try to figure out the answer to your question if you want to together. I have some thoughts. I'm using it tomorrow for a lecture, but yeah, I think there are some things we can use for sure. Jean?
Yeah, I'm Jean Klein. I'm in the St. Louis area and I'm still working. So some of my constraints have to do with the time schedules there, but I had the last couple of years been involved with meeting with aides of the local senator. And, that was the training had been really good. I felt like the training and leadership and that process was so helpful. So I hope to learn more.
We appreciate you coming. Robin?
I'm Robin Cooper. I am in San Francisco, California. I am one of the co-founders of an organization called Climate Psychiatry Alliance. So my professional involvement as a psychiatrist has been a part of my being a co-founder of that group and dealing with the mental health components of climate change.
Terrific. Thanks, Robin, for being here. Cynthia?
Hi, everyone. Cynthia Mahoney. I am a retired nephrologist. I live in Danville, California, which is part of the Greater Bay Area. And I also work with Climate Health Now and co-founder of Voting for Climate and Health.
Terrific. And Alan?
I apologize, my camera isn't working. I'm actually a second-year medical student. I'm relatively new here to learn.
So I got that you were a second-year medical student, but I missed the end. Did somebody else hear it?
In Illinois. So
Put it in the chat for us if you don't mind, Alan. That would be great. Yeah. We love medical students. We're so glad you're here. You guys are the best, I'll tell you that. I'm putting in the chat an organizational sign-on. I know some of you guys have already signed on to it. And we've got quite a few organizations, including the Consortium in Healthcare Without Harm on it now. And CCL has signed on, asking Health and Human Services to reopen the voluntary pledge that healthcare systems can sign on to decarbonize and introduce climate smart policies. And the deadline I had said was January 30th, but we decided to extend it to February 17th. But please, if you haven't already signed on, or your organization hasn't already signed on, then if you don't mind and you want to, or you can get permission, or that your group appreciates that, please sign on. And what we're going to do tonight is a little bit different than we have done before. And what we're thinking, CCL has expanded its policy parameters. And so we're thinking about those 4 parameters. They're still, supportive of a carbon price. I'm sure you guys all know this. They are supporting natural processes, especially starting with forestry. They're focused on permitting and electrification. So I think several of these kind of overlap, and what I was hoping we would potentially do is open up a discussion about some of those, especially as they pertain specifically to the healthcare message. So what I'll do first is share a screen where I put 4 different things that I thought maybe we could talk about. Can you guys see my thing okay?
Yeah.
Yeah, says Robin, good. So there are 4 different things that I thought we could talk about. I mean, everybody here, I think, knows the advantages of carbon pricing. And actually, Deirdre, who's on the phone, who's on this call right now, gave us a heads up, and I'm embarrassed that I don't keep up with the literature well enough to see this, but the New England Journal of Medicine had an article about the IRA and how it's helpful with health effects, but it also discussed carbon pricing, and it really does it in not a very informed way. And we thought maybe we could rebut to that. So that's one thing that we can do. That wasn't on our list of 4, but I think that's something important. And I thought we could start with the draft and circulate that. It's mostly just kind of, explaining the difference between carbon fee and dividend and cap and trade and, some other educational things. Do you want to comment on that anymore, Deirdre, at this stage? And I can't see you.
Yeah, sorry. No, I just thought there were a couple of things. One is he made the carbon pricing is politically impossible argument, and didn't seem to be aware that we were one vote away from getting it included in the Inflation Reduction Act. So I just think that the author, who is an environmental law professor at George Washington University, really needed to be rebutted, because people will read this and think, oh, he must know what he's talking about, but I don't think he does.
Yeah, and I think, he made a distinction between carbon pricing and cap and trade. Well, cap and trade is a type of carbon pricing. Not that that really matters that much. He didn't seem to understand the possibility of a dividend or a steadily increasing price, or even what the difference between a gas tax and a carbon price is. He conflated a gas tax with that. So there were quite a few things that we could refer to the Columbia paper. I'm sorry, my son's home. Can refer to the Columbia paper, and there's lots of things we could do. And the real question is, we're going to need to figure out, I think we as a group can write it. The question is, who can we get to submit it? And that there will lie the real problem, I think. Any other comments about that? Or I'll just put it, I don't think I put it in the chat. So let me put the article in the chat so people can look at that. And that's something we can talk kind of on our own after this if people are interested. But if people have any comments about it now, I'm happy to stop and entertain those.
Well, could you bring that article up one more minute?
Sure, and I just put it in the chat.
Oh, thank you.
Sure. Anything else? I can't either just say something or raise your hand using the raise your hand function, because I can't see everybody at this time. Okay, so we'll go back onto these other 4 things that I thought kind of correlate with the issues, the broader CCL mandate. And so the first one here is kind of a variant on carbon pricing as a whole. And that is, and I'm sure everybody on this call is probably aware of the fact that at the COP in Glasgow, the US committed to decarbonizing healthcare sector. And in response to that, President Biden introduced through the Health and Human Services a voluntary pledge that hospital systems can take to decarbonize healthcare. So I know that a lot of us on this call have state affiliates to the consortium that are working on trying to mobilize volunteers to encourage their healthcare systems to take action on climate or to sign this HHS pledge. But one of the things that I don't think is written about a lot, and we could actually even probably include in that op-ed in the response to the New England Journal article, Deirdre, is the fact that an economy-wide price on carbon would really help with scope 3 emissions, the emissions that are dependent on all the things that the healthcare system purchases. If there's an economy-wide price on carbon, then there's incentive for pharmacy and food and everything to decrease the carbon footprint. So it would help a lot with scope 3 emissions. Any comments about that? Any discussion about that? Any thoughts? And Cynthia's bringing up the issue of carbon pollution pricing. It puts it in terms medical folks relate to. That's a really good idea. What do people think about that?
Cynthia, could you clarify what you're talking about?
Sure. I've heard people use this instead of calling it carbon pricing, which is wonky and people don't really know what that means, and they can imagine all sorts of things. But if we call it carbon pollution pricing, where what we're doing is putting a price on the pollution, on the waste, on the externalities, on the damages, it puts it in terms that health people are more used to thinking about. I mean, we're used to thinking about criteria pollutants, and we are already regulating pollution. We don't think of ourselves as regulating carbon, but we regulate pollution. So if we call it carbon pollution pricing, think it's easier to understand. And I'm trying to remember if there've been some studies on how people relate to that, but I know CCL leadership has started using that term occasionally. It makes a lot of sense to me.
Well, yeah, it makes a lot of sense to me because honestly, I imagine there's a good segment of the population that doesn't even know that the C in CO2 stands for carbon.
Right.
And, and so it's a pollutant to our atmosphere in many senses. So I really like that idea.
My Republican member of Congress always says, don't talk to me about emissions and don't talk to me about climate change. Talk to me about carbon pollution.
Oh, really? And that's
Yeah.
a Republican. Interesting.
Yeah.
Yeah, Lisa,
Go ahead.
this is Rob, and I don't disagree with that, but we are all members of the choir, and we have changed messaging so many times, and a lot of literature out there refers to carbon pricing, CFD and others. So we also have to consider the downside of changing the wording and adding confusion. So if it's just coming from CCL, it's not going to have a huge amount of impact. If it's coming across the whole sector of the climate change sector, then that'll make a huge difference. So before we commit to that, I think we ought to look into that, and obviously talking to somebody like Ed Maybach or Rob Gould or some of the others in climate communications would be a good person to ask. So,
right. That's very well taken.
That is a great idea. I'm gonna put I personally like it, but I think your point is really well taken, Rob. So can I do a little action assignment to you? Either Cynthia, since it was your idea, or Rob, to reach out to Ed and ask him if he has any ideas about how that would resonate.
Yeah, and I think we'd want to get buy-in from CCL National that's a term that I've seen them use it, but that they think that that's a good idea for us to use it. The other thing that goes along with that is that I was also thinking about the bill that White House introduced that we loved so much, and I've forgotten the number or the name, but one of the
Save Our Future Act.
Yeah, one of the wonderful things about that is that it protected frontline communities, et cetera, by having a price on criteria pollutants.
Yes,
and so if the more we can pull those things together, it seems like that would be a good thing. But yes, we should get buy-in from other groups and people who really study communication. So I can reach out to Ed Maybach.
That's great. And I'm happy to run it by CCL National unless somebody else wants to do that. Other ideas about who to run it by? And I think there's another comment in the chat that said, would it be clear or helpful to include AKA carbon pollution pricing after the words carbon pricing? I do that a lot, and I in writing, I think that's a great way to do things. Although you end up counting words a lot of times and end up getting rid of stuff you really want in there. But I think that might be a way around it. But good points all around.
Yeah.
So go ahead, Rob.
I was going to say, we may want to, I think it's reasonable to contact ALA, given that they're out there with messaging across the board, and possibly APHA as well. And if we talk to Ed, that'll include the consortium, so that takes care of that one as well. I guess the other thing is, Cynthia, that may be worth including in the question to Ed Maybach about the AKA. Again, we understand it, but a lot of people don't. That's adding a lot of words that's confusing to a lot of people. And the other side, the fossil fuel companies and others, will take advantage of every single lack of clarity or ambiguity in the messaging they can. So we need to be very precise.
I think it's great to reach out to them. I don't personally feel like I'm happy to reach out to Liz Scott or somebody from ALA, but Robin, I know you sit on those meetings. Would that be something you felt comfortable reaching out to? Are you on there?
With ALA, I can, but I know I won't be at those meetings for the next few weeks.
Okay. Okay.
But I would, I could do that. Just in terms of this conversation, years ago, I think we used to talk about using our atmosphere as a free dumping place for our waste. So it's very in line with those earlier years ago messaging.
I agree.
And Al Gore used that messaging at Davos, that, we're using it as an open sewer.
That's what it was, open sewer.
Mm-hmm.
And I really do think that part of, clearly part of the push back is coming from the far left and health. And, the health seemed really focused on regulatory, responses, which I think are important and good, but that's often focused on pollution. So again, there's that kind of resonance there.
That terminology of using the dumping ground is also what Bob English uses with Republic N.
Mm-hmm.
I'm glad you brought that up, Cynthia. Thank you. Any other comments about how we might be able to emphasize this point in terms of scope 3 emissions and decarbonizing? Okay.
Excuse me, Rob, could you repeat the second thing that you mentioned that I should ask Maybach about at the same time? Because I was busy.
Yeah, using the phrasing, AKA carbon pollution or
AKA,
carbon.
thank you. I was too busy typing other stuff and trying to listen. So I'm already bitasking, and multi is way too much.
Okay.
Thank you.
So Lisa, I just want to get back on that point about that pledge, a voluntary pledge. I think it'd be fantastic if we could get the vast majority of health organizations to sign on to this. And apparently, I just learned out about this. And apparently, the deadline has passed, but there's an effort to open up the deadline to allow more organizations to sign that pledge. Is that correct?
Yeah. So right now, the HHS has not reopened the pledge. We have started a letter to go to HHS. That's an organizational sign-on, encouraging HHS to reopen the pledge for other hospital systems. And that closes on February 17th, asking them to reopen the pledge. And so I think I put the link in the chat. I can do that again. Do you need me to put that link to the letter in the chat, Don?
No, but I was a little confused. It looks like it's only for organizations to sign on. Is that correct?
Yes, it's an organizational sign-on to ask HHS. So, what would be great is if we could get some of the medical societies. I know a lot of groups, a lot of people here are affiliated with state health organizations, and so they're welcome. Robin, Climate Psychiatry Alliance would certainly be welcomed. Cynthia, the California groups, both of your groups would be very welcome. They're all, organizational though.
Oh, so they haven't signed on yet? Okay.
I didn't see their names.
Where is Healthcare Without Harm in terms of leading the efforts?
This effort? Yeah, so Healthcare Without, okay, to start out, I think Healthcare Without, I don't know this, but I think Healthcare Without Harm Practice Green Health was probably behind the original efforts to get at the COP to get these different countries to pledge, to commit to decarbonizing. I think they were way out there beforehand. They've never told me that, but I think that. What we do know for a fact is that Healthcare Without Harm, the consortium, and the National Academy of Medicine are all really supportive of this idea of decarbonizing healthcare, and they're, you know, putting out webinar series and really very supportive of this. Then when Micah and the Wisconsin group came together to write this last letter that's going to HHS asking them to reopen the pledge, we ran it by Amy Collins and Antonia Herzog, asking them what they thought. So Healthcare Without Harm is on this and thinks it's a good thing to have this letter there. Did that answer the question?
Thank you.
Sure.
Yeah, we have a number of people on the call from affiliated with California Medical Association. I certainly think they should sign on to this. I'm sure they would. I mean, everything that they've done so far would be consistent with this pledge. So I think we should make an effort in that regard.
Don, if that could happen, I think it would influence a lot of other state medical societies to sign on, and I think it would be a great thing if you guys have the bandwidth to do it. That'd be great.
I'll certainly look into it.
Great.
Yeah,
Great.
Don, this is Lee. Keep me involved in that loop. I was thinking about going to the local organization, which is a little easier, but keep me posted.
Okay, will do.
Anything else about healthcare decarbonization and resilience and carbon pricing or any of that? Also carbon pollution pricing.
Yeah, I don't know if this exactly fits in there, but if we're talking about the idea of why carbon pricing is necessary and rebutting the regulatory only position, or the fact that it can't be useful, I think the fact that we're seeing other efforts that are not transparent fail, like the offsets, says that we have to rebalance things that we can't. Did everybody see that, or that article that came out in the last couple of weeks showing that like 99% of offsets are not worth anything?
I'm not surprised, but I did not see the article. So if you know where the article is, maybe drop it in the chat.
I can't find it that quickly, but I'll try and find it so we can post it. But I think that's really important, because it means the whole net zero idea is bogus, and that what we need is direct emissions reductions that can't be fudged.
Do you have any idea the source of it? Was it like Columbia, or, you know, some sort of credible academic institution that has evaluated it, or was it opinion?
It wasn't opinion. It was a research. Somebody had researched and looked at what these have done. And I'm sorry, I don't remember.
That's okay. But that would be great to know. It's so important. Thanks, Cynthia. Anything else, you guys, on that one? Okay, I'm going to go on to the second bullet point. Everybody here familiar with the permitting reform policy effort that CCL is putting out, and why they're putting it out? And if not, I can run through that real quickly.
I would appreciate your running through it quickly.
Okay. And anybody can feel free to help me, but permitting, well, there's a study out of Princeton that it's called the repeat study, that looked at the fact that if we don't build out transmission lines, high energy transmission lines, at a more rapid rate, we're building them out at about 1% per year, and we need at least 2%, maybe more. There's two things that might happen. One of the big ones is the fact that we may not realize all of the IRA potential in emissions reductions. In fact, they estimate it could be as low as 20% of the total IRA emissions reductions that we could get out of that. It might be only 20% of that if we don't build things out more quickly. And the second thing is, because there are all these incentives to electrify both transportation and building sector, if we don't build things out quickly enough, what will end up happening is you're powering them with coal. So that will actually worsen air pollution issues. So it clearly is a messaging around health that's important. And what's hard is that Manchin tried to deal with this after the IRA, but threw in his pipeline at the same time, which then dubbed the Permitting Reform Act as Manchin's dirty deal. And what's concerning is that we didn't make the compromise at that time, and now we have an even more Republican House. So when we may have to compromise on this issue in order to get the permitting reform through as quickly as we need. The other thing that they looked at was specifically what is in the queue for being built out right now, what is being held up by lack of permitting reform. And almost all of it is clean energy, solar, wind, and battery storage, with a little bit of natural gas and no coal or oil. So essentially none. So it really, if permitting reform were relaxed across the board, then it would almost all be clean forms of energy that would come out. So I guess what I wanted to talk about is what I'm hearing from a lot of my colleagues, when I talk to them at, the Medical Society Consortium and other state affiliates, is about Manchin's dirty deal. Manchin's dirty deal. We have to get together. We have to oppose it. Da 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 da. So I think it's really concerning in terms of permitting. I think it's also kind of comes into the whole discussion below it. One of the things that we do in CCL that's different than other groups is we try to frame things in a more nuanced way, and we try to get, we recognize that the most lasting legislation will be bipartisan, and we have to work across the aisles to do that. So I guess I just wanted to open up the discussion regarding both of those things. Does anybody have any ideas about how we could potentially reframe things in terms of permitting reform? And then the issue below that had to do with there's a group. Well, there's one treaty that I actually think is really very interesting and really well worded. That's a global group. That's the Fossil Fuel Non-Proliferation Treaty, which I think non-proliferation to me is different a little bit than the other one that's being started out in the US among some of our colleagues in the state affiliates, called Fossil Free for Health, which is like no fossil fuels. And, I'd love to live in a world without fossil fuels, and I definitely think that needs to be the end point. But I also think we need to be able to talk about this in a way that recognizes it's a transition. It's going to be, we're going to have to move through this in a gradual way. And as much as we'd like to stop boom right now, we probably couldn't function if we did that right now. So I just wanted to open up the discussion, with the group about how can we work on some of this nuance? What can we do as a team? Bob, you have an idea regarding that or a thought?
Yeah, our local chapter the last week actually addressed these different areas, and I didn't know what I was doing, but I volunteered for permitting reform. And so everybody said, good luck. And if you look at CCL's approach to this, they say this is really not a grassroots issue. This is a grass tops issue.
It is.
And I think for this, to make it a short answer here, it looks like ultimately we will have to find a bill that's going to include the proper wording that we can then get behind. And every point that you made is spot on in terms of only reaching 20% of the IRA's potential if you don't get the infrastructure to convey the energy. I listened about the different topics or the presentations on this on the CCL website, including, is it Dana Nuch?
Nutricelli,
Nutricelli.
yeah.
his talk. They're all pretty high level, about the importance of having permitting reform and improving infrastructure and transmitting the energy, and nothing gets really down in the weeds in terms of how this is accomplished. Now, I put a link in the chat that I found that talked about Manchin's bill. His bill itself is 91 pages long, so I didn't drill down on it, but one of the links there, or maybe I didn't include it, kind of talked about the actions he wanted to take. And the very last one was the Mountain Valley Pipeline. So that was kind of the poison pill.
Really was.
So I guess what I'm trying to say, bottom line is, looks like we need a bill that addresses it, we can get behind. I don't know what we can do, like I said, at the grassroots level, other than saying, yes, we need permitting reform. Can we talk any of our representatives or senators or anybody else to get behind this? So anyway, that's my 2 cents worth.
Thank you. I guess just to clarify, and maybe this is what you mean by grassroots, but what I was thinking of was, how do we educate our colleagues, especially those who are in the climate and health arena? How do we do that? Because it seems like they're actively working against permitting reform because they've lumped it into Manchin's dirty deal. And I'm very concerned that, maybe I'm not being fair. Maybe I don't understand their nuances.
Yeah.
But I wondered what other people,
Well, is Manchin's whole bill dead, isn't it? I mean, wasn't that something that he supposedly had an agreement with Schumer that would be introduced
it is dead.
independently, and it didn't get anywhere. So I don't think we're going to see anything more from Manchin. I don't know, unless somebody knows differently.
I heard on the liaison call that there are Republicans saying that they need to take on permitting reform.
Yeah.
And I guess my concern is that, or I think it's likely that there will be, it'll open up fossil fuel permitting as well. I think Wayne's shaking his head, and he said he's done some work with permitting as well as renewables. So I'm just worried. I guess you're right, Bob, that Manchin's dirty deal is dead, but has it poisoned the well for all permitting reform? And can we help to make sure that when it comes up again, that there's, that people are more open to the idea that.
Yeah, not that people equate permitting reform with Mountain Valley Pipeline, that it's its own entity that we definitely need to get behind. Yeah, I agree with you.
Right. Lee, what are your thoughts?
Well, I was very interested in a couple of discussions on the Ezra Klein show late last year. One came out right after the IRA and was a terrific discussion of what's in the IRA, with a passing glance at carbon pricing as politically impossible, to which I started to compose a reply, and this discussion reminds me I need to follow through on it. But what he really emphasized is that the bill enables all kinds of things, but doesn't put in place the infrastructure to make them happen. That you can say, we're going to give this and we're going to do that. We're going to have these incentives, but then you have to create language and you have to implement it. And it's made the same points that I think Dana makes about the need for infrastructure in the grid and the enormous complexity and delays built into permitting at this point. And I don't think people appreciate that at all. So I think that's important. I think permitting reform is inherently going to be, if not a hot wire, at least a very warm wire in the equity community, because it does say, well, you don't all get to object to everything you don't like, or I'll say the left in general, that, we need to build these things and we can't have every community having its own review process and have this very complex regulatory situation that really impedes action. And I don't know where that falls, but I see that as a major kind of, it's not ambiguity exactly, it's a two-edged sword that we need to be very thoughtful about. So I don't know how to do that particularly, but I think it's an important and real issue.
Good, Lee, I agree. And, you know, it almost brings up also then the kind of the flip side of related to permitting reform is the issue of siting, you know, which is the more local issue of build out. And again, at least in Michigan, I've been contacted by lots of people, and there's a lot of coalition work regarding the fact that there's tremendous amount of misinformation, really kind of fueled by social media. That's coming out in these rural local areas where some of the clean, you know, solar and wind wants to be sited, and a lot of misstatements, and they want us as health professionals to speak up to that. So,
well,
I
you know,
agree.
on the one hand, we want the right to have the right to protect ourselves and our communities. On the other hand, my understanding is that like power line construction, energy motion is the only interstate commerce that over which the federal government has very little control, and it all defaults to cities, counties, states, and other entities, each of which has to sign off. And I can tell you from a long time listening in California on, for example, water and shoreline access, that these debates are endless and very difficult in many cases.
This is scary. Cynthia? You're muted.
I'm working with two computers and getting really confused about which control, sorry. A couple of thoughts which are not very well organized like Lee's here, but that maybe one of the important things we can do, since a lot of this is happening at the state level, is somehow get this information out to state affiliates of the consortium to look at permitting reform in a more nuanced way that we've heard from CCL, but other people may not be hearing. They're hearing more from EJ or frontline communities. I don't know, but and I don't know what the vehicle would be, but I think that we should be thinking about how could we get that out to the states, because that's where it's happening. The other question is about working with allies, like getting this message out. There's a health component, because if it doesn't happen, we won't address climate change adequately. But the people who are working on the front lines and locally at this level, like land use and permitting, has not been CCL. And I wonder if that's more 350, or we need to think about how we could get this message out and ally with other groups. And again, I don't have an answer, but to start thinking about it. And thank you so much for just bringing up this meeting for us to think about it. And the third brief thing is about permitting reform. So we've got to get rapid permitting for new clean energy and guard against permitting reform that facilitates more dirty energy. And that makes me think a lot about the pollution pricing and getting out that message about the social cost. And that maybe if we can get that social cost, including the health cost, and get that well known, that it's going to make it more difficult if somebody has carbon capture and storage or whatever, that we say, okay, fine, you've got this permitting reform, but it has to be cost effective. And the cost you're looking at isn't $50 a ton for damages, it's $200 a ton. And somehow getting that to be the default.
Interesting. There's two things. One, I think, and correct me if I'm wrong about this, and I'm looking to Wayne a little bit because he said he did permitting stuff, but my understanding is that permitting reform is a federal issue that are talking about high voltage transmission lines, whereas siting is a local issue where you're building out the actual infrastructure. Is that correct, Wayne? Or is that overly simplistic? Or
I'm not really that familiar with the permitting of power lines. That's whether it's state or federal. I'm not that familiar with it, but I guess part of my.
I'm sorry, I put you on the spot then. I'm
No, no.
sorry.
Well, I wanted to mention two things. One, I'm not sure if, how should I say it, if this is really the best role for the health action team to take on. Because we have a specific level of expertise and value and connections, and is permitting reform something that's really something that deserves our time and effort and energy, because that's way outside their expertise that this group really brings to the table, which is really super important and valuable. The second thing, and again, I dealt with permitting everything from nuclear power plants to dealing with environmental impact statements. There's a lot of nuances, a lot of things that are really complicated. And I could see where once we open up the door for, like with Mansion, there's the opportunity for things that may be problematic, that it took us, tens of years to get implemented through the laws, to be short-circuited. So we need to be somewhat careful, whoever deals with this, but the people that need to deal with it need to be plugged in with the nuances and do a lot of the upfront research. And like I said, I'm not sure that's something at this point in time we should really, spend the time and effort on. But like I said, that's some thoughts that I had.
Two things that I want to say, and I appreciate that very much, Wayne. And I think it's a valid point. When I brought it up, I'm thinking mostly of reaching out to our health professional colleagues. Not that we would lead the permitting overall, but it really concerns me because a lot of the health professionals are just kind of deferring to the messaging that's coming out from the extreme left. And that concerns me a little bit. And then permitting reform, which is really not a CCL issue. I wanted to show this real quickly. I think there is a role for health professionals with that, just because local people really care to know that wind energy, hopefully, that wind energy doesn't have health impacts, and that's kind of the mismessaging. I did want to show, this comes from Dana's lecture, and this is what are the projects that are being delayed right now, and this shows you the projects that are in the queue right now, and almost all of it you can see is solar, storage, wind, with a little bit of natural gas, nuclear, coal, almost nothing. So just so that you know, if we had an across the board permitting, most of what would come out would be solar and wind. Deirdre?
Thanks. I was just wondering if anybody had reached out to CCL's legislative team, Ben and Jen, to see what their reading is on permitting reform in this session. Because, I think it's clear from what happened to Manchin's deal, right? He thought he had a deal, and there was just such overwhelming progressive opposition because of the pipeline that he slipped in.
Yeah,
and maybe they have some, some insight into where things are.
Has anybody else reached out to Jen? I sit on the liaison calls, and that has not come up yet, although permitting reform, as we all know, is one of the issues that CCL says that they're going to be behind. But I have not heard Jen or Ben tell us yet what we're not lobbying again until June. And I think that they're just waiting to see what plays out. So I don't know if permitting reform is actually going to be an issue that they want us to talk about in June or not, but that's a really good point that maybe we should find out. And again, my concern is just mostly, I feel disappointed that Manchin's dirty deal didn't get passed, to be perfectly honest. Not that I want the Mountain Valley Pipeline to go through, but almost everything would have been clean energy, and we could have realized more of the IRA. So I think that misinformation that was there, the framing, this is just my opinion, in a very binary way, resulted in killing a bill that was probably as progressive as we're possibly going to get in the near future. And if we wait another 2 years, I mean, we might have even more conservative and or we're out of time too. So I don't know. Robin, were you going to say something? No, you lit up. I thought maybe you were saying something. Okay, so we're at 9:22. I appreciate you guys talking about this. There was 2 other things. One we kind of touched on, but we can pick up some other time if we want to, which is, again, you know, do we have a role? You know, many of us are working also with a consortium. Is there something we could do to help with the nuance around the idea of, you know, no more fossil fuels, or do we want to embrace that? Or, you know, I don't think CCL National would support that. I think that they're, you know, that's the end goal, yes, but I think they, you know, recognize that it would take a gradual change as quickly as possible. So we could talk about that. And then the last thing was what's our role as health professionals to make sure we get the vote out, and, you know, protecting a healthy democracy was another thing that we thought about being part of the messaging. So we can talk about those now, but before we do that, I just wonder, what should we do as next steps as a group? We've spent, you know, some time talking about this. Do we want to, you know, try again in a few weeks and talk, you know, next month and talk about this, or do we want to wait a couple months, or just, you know, this was fun, but we're done, you know, whatever. I don't really care. I just thought maybe, you know, do we want to take some action, or what do we want to do? Cynthia, I like the term phase out. Clearly implies the process is gradual, but the end of the goal is none. I like that too. That's good, Cynthia. You are such a wordsmith. Phase out. I'm going to put that down. Deirdre?
Lisa, I was wondering if you thought there was any role for this group in publicizing what the decarbonization benefits might be for healthcare systems in the Inflation Reduction Act.
So,
in other words, one of the things that CCL is talking about is electrification and conservation, right? Essentially, it's building decarbonization. And it's in the context of getting out and publicizing and defending, I think, the Inflation Reduction Act. And I'm wondering if your audience isn't, you know, hospitals and you know, healthcare systems, and helping them to see the benefit, you know, identifying what the benefits are for them and helping them to see the benefits in the Inflation Reduction Act. Because I am sure, for example, that our local healthcare district, which is not a paragon of, you know, progressive thought in this area, has no idea what's in the Inflation Reduction Act, or that they could benefit from it.
I think it's a great idea, Deirdre, and I know a lot of us are working on the hospital healthcare decarbonization issue. I have to be honest, I haven't had the bandwidth to listen to a lot of what CCL is putting out on the decarbonization stuff. And if it's specific to the IRA, I think that's a really good idea. Rob, Lori?
Yeah, so Lisa, I mean, I agree to an extent with Deirdre, but at the same time, I think we need to go back to what you said, and that is that Healthcare Without Harm has been way out in front on this, and that is what they do.
Right.
So I think if we want to do that, we have to be very careful to do it in conjunction with what they're already doing,
Right.
And not sort of step on toes, because they're doing a great job of it, and they have more power or more influence in that sector than we do.
Although I have to say, I've looked at their website anyway, and yes, they have been working on decarbonizing the healthcare sector, but I haven't seen anything specific about the benefits of the Inflation Reduction Act.
Antonia Herzog, who's their policy person, has written something on it. It may not be very, their website, I'm sorry, is not great. And they also have a statement on carbon pricing, which is not at all forward facing, but if you ask her, she'll send it to you. But so she does have it. In terms of what you said, Rob, what we've done in our state organization is, as we're developing our campaign, and Steve is my right-hand person on that, developing our campaign in Michigan to push out to healthcare systems, we have reached out to Healthcare Without Harm, and we've had some meetings with them so that they know that we're doing this and asking for their advice and kind of working hand in hand. But so I think that's important, Rob. I do, because they are out in front. We want to be respectful. I think to what you said, Deirdre, I think you're right. And I personally have not done this. Steve, you and I have homework to do. And that article in New England Journal of Medicine, I don't know how well they've done it, but we could also go to the CCL website to really frame that in terms of what does the IRA do. And I have not taken the time to think about that specifically, but I think that would be a great way of framing things. And Rob, do you think that would be stepping on their toes as long as we're keeping them in the loop?
As long as we keep them in the loop, and I mean, they're a great resource too, because that's where they live.
And if they're working on it, that's great. And maybe we can piggyback on that.
Yeah, I agree, Deirdre. I think at least when I've reached out to them, they appreciate that we have people, right? And even if the state health groups, I think there's a role for constituents and community working with health professionals to reach out to healthcare systems. I think there's more power if there's both the health professional and the community asking for their hospital system to take this on. So I think there's role for CCL and health to do exactly what you're describing, being polite and respectful of Healthcare Without Harm and asking them to participate to whatever extent that they want to. Wayne?
Yeah, to respond to your question, I think having another meeting like this would be a good idea. Second, I think there may be certain things in the IRA, I don't know whether we really want to get into it, but let me just throw out an example. There was a recent article that came out regarding the concern with gas stoves. There's an induction range. There's provisions in the IRA for, especially for people that are of our lower means, to replace gas stoves, and it's almost 100% reimbursable with induction ranges. Again, we could reach out to, there's a concern with increased asthma incidence. We could reach out to that group to basically let them know that this is an option. They could basically point this out to some of their patients. And, I'm just saying there might be some opportunities like that if we want to get down into the weeds. But like I said, we may not want to do that.
I would guess a lot of us on this call are asked to do public speaking as health professionals. And I often mention the gas stove issue. And I now have incorporated the IRA Rewiring America calculator in my presentations so that they know how to access some of those funds. So I think that's a great idea. Cynthia?
Oh, I'm going to lower my hand.
Okay, Lee?
I would also mention that the direct pay provisions of the IRA, which enable nonprofits and government entities to take advantage of the investment tax credit and production tax credit for clean energy projects, is a boon. I mean, that's just huge. And in my community, very few people even know it exists. So, those are some of the kinds of things in the IRA that I think we need to get out to our nonprofits, and most medical centers, I believe, are nonprofits, right?
Yeah, good point, Deirdre. Thank you. Lee?
Yeah, I'll try to be brief. Maybe this is more something we could do next time, but along the lines, Lisa, of your suggestion that we write a response to the New England Medical Journal, I took something you wrote and created a sort of a bibliography of recent healthcare issues and air pollution and sent it to the Retired Physicians Bulletin for Kaiser. And I'm thinking I will send it to my local medical association group and see if they want to publish it. If we took the New England Journal article and put it into very simple language for physicians and their patients and said, here's what's available, I think going through medical associations and groups like that is really, really helpful, really important, just to give them something to keep this issue in front of people. And that one thing this group could do would be to write not so much position papers, but something that we could give to anybody in any state and say, here's something you might want to consider sending to your medical association or to your hospital or to whatever, and not necessarily in simpler language, because I don't know who read this. I have this article sitting here waiting to read, but it's the New England Medical Journal. I have to find 5 minutes or 10 minutes to sit and digest it, and I want something I can read in 1 minute.
To your point of doing it to the medical societies, I'm taking a course in messaging, and one of the things that they said about health professionals in particular is that they defer to their professional societies to give them permission to advocate. So like the work, so Cynthia knows that, that's great. So a lot of the work you've done, Don, for example, you know, with the California, and I know you've worked with a lot of people on this call, Lee and Cynthia, and et cetera, to do that, getting the professional societies buy-in on that stuff. I think it's a great idea, Lee. I don't know where you went. Oh, there you are. I think it's a great idea. And then I think in simple terms to get out, you know, to just health professionals in general to put in their office or whatever. Cynthia.
Yeah, I'm wondering in terms of simple, concrete things that we as the health team could do for other CCL members, and maybe this is already on the website with the IRA, but providing a couple of slides for other speakers that say, this is the health message about implementing the IRA and what will happen to health in terms of climate, what will happen to health immediately in terms of decreased pollution, and having it, you know, state specific, or giving people a resource that this is how you can find out what the benefits would be in your community, your hospital. Maybe that's difficult to do, I don't know, but it seems like that would be a very useful thing for us as the health team to do, to spread that message very broadly.
I think if we went through Dave Kane and the presenters group, that would be a really helpful way of doing that. If we had, you know, a simple set of slides that that described, you know, the IRA in terms of human health in particular.
Right.
Yeah, it's a good idea. Okay, we're 5 minutes over. But I really appreciate everybody's input, and, you know, feel free to reach out again. And for those of you who haven't been on before, I really appreciate you being here, Alan and Patsy. I don't know if this was your first time here, but I'm glad that you were here, and I'm glad everybody was here. And
I've come sometimes, but not too often.
Oh, you're
It's
the
late.
Yes, I remember that actually, and I'm sorry. And we'll try to figure out when we're going to do it again.
So Lisa, I just moved that let's do it next month.
Okay, we'll do it next month. What do you guys think?
Because
sounds good.
Okay.
Right.
That's great. Thanks to each of you for being here, and
thank you, Lisa.
Yeah, sure.
Thank you for creating a space for us to be.
Exactly.
Well, I think we all did it. So thanks a lot. I appreciate it. And we'll write it down, and we'll be here at this same time next month. And maybe we'll have written a response to the New England Journal by then.
That's a good idea.
And if people want to be actively involved in that, let me know. I'm going to try to come up with some sort of draft that we can work from, but I'm sure we'll pass it back and forth a million times so we get it we do something good. We have a right. Okay, and here's to Lori and let the it is the most horrible feeling in the world, I'll tell you guys. And I'm sure many of you have probably had it, but so I really hope she feels better. Oh, thank you, Rob.
Thanks, folks.
Good night.
Bye-bye, everybody.
Everyone.
Night.